There are now more than 17 million known cases of COVID-19 across the world. And as of today, 2,129 cases confirmed in Namibia. Namibia's rate of daily new cases has risen to the fourth highest on the continent, following South Africa at number 1, Eswatini at number 2, and Gabon at number 3, respectively. The pandemic is changing rapidly in our country. It took 4 months to record 1,000 cases. However, it has taken only 14 days to record 2,000 cases in the country, of which over 95% are from Walvis Bay. From the onset of this pandemic, I have maintained that the health of Namibians is our biggest priority. It is therefore highly regrettable that to date we have lost 10 Namibians who succumbed during July 2020. Of the 10 fatalities, 9 were from Walvis Bay, and yesterday Windhoek recorded its first COVID-19 related death. I express on behalf of the government and the nation at large our deepest sympathy with the bereaved families who bear the loss of their loved ones under very difficult circumstances. As much as health imperatives demand physical distancing, this is a time to empathize and provide solace to one another. May God comfort all those who are mourning. There are now confirmed cases in 12 regions across the country, with exception of the Kavango West and Omaheke. While community transmissions was confirmed at Walvis Bay in mid-June 2020, there has been a steady increase in the number of cases in Windhoek, and community transmission is now suspected in both the Khomas and the Qaras. With the rising number of cases in the country, the public needs to be assured that government is putting in place all necessary measures to respond to the situation. We'll continue to do everything in our power to mitigate the impact of this pandemic. Government is continuously strengthening the public health sector and national testing capacity. A total of 27,785 tests have been conducted as part of the targeted mass testing and active case search. This represents a testing ratio of 1 to 10 people per 1,000, which is among the highest, not only in Africa, but the world. Although we have made a considerable improvement in clearing the testing backlog, we continue to experience delays in testing and disclosure of results, owing to the large volumes of samples. To increase the national testing capacity that currently stands at an average of 1,150 tests per day, we have expanded laboratory capacities at Windhoek, Keetmanshoop, and Oranjemond. Next week, we will commission new testing laboratories at Walvis Bay and Oshakati, which will significantly boost our capacity and ability to quarantine and isolate positive cases sooner. With the rising number of infections, Cabinet has approved the recruitment of more health professionals to strengthen our national response. Some development cooperation partners have also availed health workers and experts to support our response. We sincerely appreciate our medical personnel and other frontline workers who risk their lives on a daily basis to serve their fellow countrymen and women. Now let me look at Erongo's specific response. I would now like to focus on the Erongo region, which is currently the epicenter in our fight against this invisible enemy. The current stage 3 level of restrictions is due to lapse at midnight on Monday, 3rd of August 2020. I hereby inform the nation that the Erongo region and a special dispensation for the local authority areas of Walvis Bay, Swakopmund, and Arandes will remain unchanged and is hereby extended from Tuesday, 4th of August until midnight on Monday, 31st August 2020. Country response. The other 13 regions of the country will remain under stage 4 level of restriction of the following revised measures to curb the spread of disease. 1. Public gatherings are reduced from 250 to 100. We want to go down further. We may do it still. But public gatherings are reduced from 250 to 100 persons. The sale of alcohol is to remain on takeaway basis and for consumption in private dwellings only, for ship-ins and bars. For restaurants and hotels, on-site consumption of alcohol is permitted as per the current arrangement under stage 4. 3. Contact sports will be permitted, but no spectators allowed. Unregistered sports activities that draw crowds must be discouraged in the communities. 4. The public must strictly adhere to the regulations and health and hygiene protocols, which are our first line of defense. Members of the public must A, wear a mask at all times, as I'm trying to do, but I couldn't speak, but I have space. B, maintain social distancing. 3, avoid crowded public gatherings. D, avoid unnecessary travel to and from different parts of the country. Please avoid unnecessary travel to and from different parts of the country. Why do people think we want to punish people? Is there pleasure in saying don't travel? We know this disease is serious. So please avoid unnecessary travels. 5, these revised measures under stage 4 come into effect from midnight 3rd of August 2020 to midnight 17 September 2020. 6, the Ministry of Health and Social Services will increase public education and information dissemination to arm the public with the information and knowledge to protect themselves and their families against this disease. As Namibians can a little bit admit when things are done. Minister of Health and his team have been working, appearing on TV, having groups to discuss and inform us. Some people don't watch that. They will still say, I don't know, I'm not informed. So please watch the TV. Education. The face-to-face mode of instruction is suspended for early childhood development, primary and grades 1 to 9. It was our aim to open it, but after consulting and listening to people, we are now suspending that. Across the country from the 4th of August 2020 for 28 days, grades 10, 11, and 12 will be permitted to continue with face-to-face instruction. These difficult decisions were arrived at in consideration of the vulnerability and risks associated with the spread of disease. And small ones will be difficult to control. You cannot tell them to all a distance. With regard to tertiary institutions where ICT infrastructures are adequate to enable online teaching, learning will continue remotely. Vocational education training providers will continue with face-to-face education for the specified period and as provided for under the current regulations. Today, we will also announce adjustments to our quarantine and isolation protocols. The Ministers of Health and Social Services will provide the details on the revised strategy. We assure the public that as the pandemic evolves in our country, government will continue to monitor and adjust the national response if and when necessary. Fellow Namibians, fire outbreak at Loloka informal settlement on Sunday evening, July 26, 2020, the nation witnessed in shock and disbelief the spread of a fire that eventually destroyed an estimated 153 dwellings at Waloloka informal settlement at Wisepmont. The inferno claimed the life of a toddler, left one resident hospitalized with severe burns, and has left over 350 of our people homeless and vulnerable. As a president committed to fighting and eliminating the scourge of poverty in our country, I have to admit that this incident has hit at my core, not as a leader, not as a politician, but as a human being. What happened at Waloloka is something that affects the human conscience, as we witness a community that was already among the worst affected by the pandemic, grappling with unspeakable loss and pain. Prior to the fire outbreak at Waloloka settlement, and pursuant to my directive issued on 6 July 2020, government had commenced with the implementation of the informal settlement decongestion strategy. However, Governor Neville Andre and the regional leadership were in the process of identifying suitable venues and facilities to relocate residents from densely populated informal settlements at Walvis Bay in a broader effort to mitigate the spread of disease among the community. In the aftermath of the fire, government has availed financial resources from the National Emergency Disaster Fund to temporarily reblock Waloloka and relocate half of the inhabitants to a different location. The National Housing Enterprise has availed land to the Walvis Bay Council for this purpose. Building materials will be purchased by government for the affected residents so as to accelerate the process of relocation. Government, together with the Red Cross, has provided relief assistance through the provision of 108 tents, 350 mattresses and blankets, kitchen sets, meat and food essentials. These contributions have been augmented by the generous and selfless donations made by private and corporate citizens from across the country. It is indeed in times of crisis that true character is revealed. I have been heartened by the benevolence, solidarity, and spirit of unity at work among the Namibian people during this time. While there are those few who have tried to capitalize on this terrible incident for political point scoring, we have seen true humanitarianism and patriotism emerge in the spirit of Harambee. Such actions reveal that we have truly embraced each other as brothers and sisters in the Namibian house, irrespective of race, tribe, gender, and social standing. The affected residents continue to face shortages, and I urge those who have the means to render support through the office of the Prime Minister. Moving now onto the Tourism Revival Initiative. I stated in my address of 22 June 2020, government's intention to conduct a targeted international tourism revival initiative from 15th July 2020 in collaboration with the industry. Following a lengthy consultation process, the initiative has now been approved to commence from Monday, 3rd of August 2020, subject to the agreed protocols. The details of the modalities are to be finalized by the National Task Team that is to be constituted by the Line Minister, comprising of the sector representatives and key institutions. Among the salient points to highlight are that international tourists arriving in Namibia will be required to present a 72-hour negative polymerase chain reaction, PCR, test results, whatever it means. Tourists will not be subjected to a mandatory quarantine. They will, however, be required to remain at their first initial destination in the country for a period of 7 days. A test will be conducted during this period, and the tourists will be permitted to proceed with their holiday on day 7, provided the test results are negative. The modalities have been carefully negotiated and agreed upon so as to achieve the dual purpose of stimulating our tourism sector and safeguarding public health. Continuous assessment will be conducted throughout this trial, which will inform and strengthen preparations for the imminent reopening of points of entry under Stage 5. I will shortly invite the Minister of Environment, Forestry and Tourism to present the protocols for this special initiative. In conclusion, we are at a critical stage. At this moment in our battle with this invisible enemy, all Namibians are called upon to embrace the principles of humanity. There will be a time and a place where we all discuss our ideological and political differences, but now is not that time. To capitalize on the misfortune and demise of our people in the interest of scoring political points is nothing but pure recklessness. We have seen that in countries where societies have adopted a unified approach to tackling the coronavirus, devoid of politics, there has been success in containment and reduction of new infections. Let us follow suit by discarding petty differences and placing Namibian lives as the #1 priority. Government is monitoring the health, social, and economic indicators on a daily basis. It is a delicate balancing act to protect the lives and livelihoods of our people, both of which are equally important. The severe restrictions imposed on the movement of people under a lockdown are effective in slowing the spread of the disease. However, such severe restrictions need to be sustained over an extended period of time to effectively eliminate the risk of infection. Our experience has taught us that a full lockdown of social and economic activities comes at equally high premium and cannot be sustained over a prolonged period of time. Together, as Namibians, we must continue to strengthen our national capacities and adhere to the precautionary measures that will safeguard life both today and tomorrow. I therefore reassure you, fellow Namibians, that government will utilize the full lockdown strategy sparingly and perhaps only when it becomes absolutely necessary. Archbishop Desmond Tutu once stated, and I quote, "A time of crisis is not just a time of anxiety and worry. It gives a chance, an opportunity to choose well or to choose badly," unquote. As Namibians, who together with the rest of the world face an unprecedented crisis, let us overcome our anxiety and worry by choosing well. Let us make the right decisions, the right choices, and the right measures in interest of health and prosperity of our nation. I thank you. I will now call on first the Minister of Health.
Thank you very much. Thank you very much, Your Excellency, Comrade President, Right Honorable Prime Minister, Deputy Prime Minister, Honorable Ministers, media practitioners, fellow Namibians. I take the floor to provide more details on the issues as announced by His Excellency the President as part of our national COVID-19 response and preparedness. Before I do so, I wish to provide context and background to these interventions. On the 28th of July 2020, during the daily briefings on COVID-19 at the Communications Center, I delivered a statement in which I laid out the need for Namibians to take the evolving COVID-19 pandemic in our country more seriously. That statement has been placed in local newspapers and placed on other media platforms. I urge all Namibians to read it and to heed to the advice contained therein. As I stated then, I wish to once again say the evolving pandemic, as witnessed by increasing cases and loss of lives, calls for greater vigilance and personal responsibility of each and every Namibian. We must do our part to stop the spread of this disease in its tracks. And yes, it can be done. In order to protect ourselves, our families, our communities, and to prevent a loss of life, the appropriate measures have been stated by His Excellency, the President, in his statement. These are the realities of our time. The only way Namibia can suppress the spread of the disease is by following and complying with these measures without fail at all times and by everyone. I now wish to provide details on the interventions just announced. The first will be on isolation and quarantine. As it was announced on the 29th June 2020, steps will be taken to build in more flexibility into the quarantine and isolation protocols in Namibia. This is to be guided by the evolving scientific and epidemiological information about COVID-19 pandemic. It is critical that our policies are driven by scientific evidence and informed by expert views and knowledge. In our decision-making, we make use of the best information available to us, both in our country and from across the globe. On this basis, a decision was taken to bring changes in our policies on quarantine and isolation for people suspected or found to be infected with the coronavirus. The science is now clear. There is no evidence of risks that somebody can infect another person with the virus after 10 days of infection if their symptoms have gone away. This means that our numbers of recoveries will rise quickly. This is to be expected. It is because we now know that recovery should be based on resolving symptoms and counting at least 10 days after infection started. It has been proven that a person may test positive for COVID-19 for many more weeks after the symptoms have resolved. However, this does not mean that such person is still infective or poses a risk to infect others. Changing the policy for quarantine and the isolation is the right thing to do because we now have the scientific and medical evidence that this is safe and longer quarantines and isolations are not necessary. This is what our neighboring countries have done. It is what many other countries around the world have done. And it is what the WHO and the CDC now recommend. This also affects our policy for quarantine, which can be shortened. A single test for the coronavirus on the 7th day of quarantine will be done. And if negative, then the quarantine can end. This will help people to get back to their normal lives sooner. It will decongest the quarantine facility, and it still keeps us safe according to all of the latest science. In terms of details, it has been determined that the quarantine protocols adopts a three-tiered structure. Tier 1, where there is no community transmission, which is most of Namibia at present time. The duration of quarantine is reduced from 14 days to 7 days in approved facilities. All to be tested at the end of the quarantine on day 7 and released on negative PCR test. If positive, the person goes into isolation. Tier 2, where there is established community transmission, the length of quarantine is proposed to be a minimum of 7 days. Contacts would all be tested at the end of the quarantine on day 7 and released once a negative result is obtained. If a positive result is obtained, they would enter into isolation. Contacts will be allowed to quarantine at home if their home is found to be suitable for that purpose. Tier 3A, travelers arriving in Namibia. The length of quarantine is reduced from 14 days to 7 days in approved facilities. Travelers are expected to arrive with a negative PCR-based result, not older than 7 days. They would only be tested on day 7 and discharged with negative results. Tier 3B applies to the special dispensation under the Tourism Revival Initiative, as has been explained by His Excellency the President. The length of staying in quarantine is 7 days in approved facilities. Travelers are expected to arrive with a negative PCR-based results and tested within 7 days of arrival in Namibia. They will be tested on day 5 and discharged on negative results. It has been decided that isolation protocol in Namibia will adopt a 3-part threshold system. Threshold 1 is when more than 60% of health facility bed capacity dedicated to COVID-19 are available. All positive cases are managed in isolation units at COVID-19 designated health facilities, regardless of the severity of the illness. Under threshold 2, this is when more than 60% of the health facility bed capacity dedicated to COVID-19 are occupied by confirmed and suspected cases. Only severe and critical cases and those at higher risk of developing severe disease or complications due to comorbidities will be managed at health facilities. All other cases will be managed in other designated and repurposed COVID-19 non-healthcare isolation facilities. Currently, Erongo and Commerce regions are in threshold 2. Threshold 3, isolation in health facility would only be used for severe cases. Non-severe cases or cases at higher risk of developing severe diseases due to comorbidities will be managed in repurposed facilities. All other cases who have living space that are amenable for home isolation would be allowed to do so. COVID-19 non-health isolation facility and home isolation will follow strict criteria outlined clearly in the case management standard operating procedures. After COVID-19 epidemic review of all available data, case management experts recommend a pivotal in Namibia de-isolation criteria. Currently, for de-isolation, Namibia uses a test-based approach and requires 2 negative PCR tests taken at least 24 hours apart. Namibia moves to a revised de-isolation protocol as follows. For asymptomatic patients will be discharged from isolation 10 days after the positive test for SARS-CoV-2. And for symptomatic patients, they will be discharged from isolation 10 days after the onset of symptoms, with at least 3 additional days without symptoms. All patients will have a test conducted on day 10 after the initial test for asymptomatic, or day 10 after symptoms onset for the symptomatics. If the test is positive, the patient will be instructed to exercise additional cautions with physical distancing, wearing of mask, and hand hygiene for the next 10 days. These recommendations are in line with the newest WHO and CDC guidance. Any confirmed COVID-19 case that has been de-isolated according to the aforementioned criteria will be considered as having recovered. Thus, recovery would no longer be based on retesting negative on PCR. Risk categorization and quarantine of health workers. Current evidence suggests that SARS-CoV-2 is transmitted between people through close contact and droplets. Aerosol-generating medical procedures are also associated with increased risk of infection. Against this background, the Ministry of Health and Social Services developed a framework to classify healthcare workers into either high or low risk, depending on the context of their work environment and the level and nature of possible exposure to infection. Those regarded as high-risk health care workers are required to be quarantined in line with the standard operating procedures, and those regarded as low-risk healthcare workers are not required to quarantine. The risk categorization is conducted by the infection prevention and control expert to ensure objectivity. Your Excellency, ladies and gentlemen, the message cannot be re-emphasized. Let us protect ourselves individually. Let us protect our neighbors. Let us protect our communities. Let us protect our country. Together we can vanquish COVID-19. I thank you for your kind attention.